name's Phil, I'm one of the injectors here at the Tracey Bell Clinic in Liverpool. What I'm going to do is I'm going to talk you through today about various different techniques that we can use. Now Alex came in today with, and the main complaint was the area here, the glabella and the corrugator muscles here. She's got quite a big frown and it extends up into this area as well. So this frontalis muscle here is what we want to be taking out with some, maybe considering using some Botox. Alex, if you just give us a frown and relax, and now you give us a lift. Okay, now Alex is only young, so what we'd be doing is we consider using Botox as a preventative measure for Alex. Okay, let's just give us a frown again. Because these muscles are very, very tight in this area, and the corrugator muscle here is quite short, we don't want to be coming too far laterally across the eye. So these are the considerations that we'd have to be looking at when we were going to inject someone like Alex. Okay, Alex, just lie your head back for me. So if we're going to do an injection, what we would do is we'd place an injection into the glabella here, and then we would place one injection here in the corrugator and one just slightly lateral to that, and that would have the effect of relaxing this muscle completely and preventing these already static lines that are starting to show. How old are you, Alex?
22.
So even at 22 she's starting to get these already what's called a static line, which will only deepen with time. However, if we can prevent this muscle from working fully, it's a bit like when someone goes to a gym, if they strengthen the muscle and they work it a lot, the muscle becomes stronger and stronger. If we can stop these muscles going to the gym effectively, what happens then with Alex is that they will relax and these lines will soften with time. And these lines across the forehead here, the frontalis area, they will also soften with time. Okay. So for the upper third of the face, so from the eyes upwards, we would definitely consider using a Botox. And that would help to relax this. However, Alex has suffered in the past from outbreaks of acne. Can you turn your head towards me, Alex? So she's got some larger open pores and some kind of marbling on the skin in this area. So the treatment for that is what we look at is that first of all we've got the canvas, the lines and the volume. So if we're going to treat these kind of fine lines here, what we also want to do is we want to give a natural skin regeneration. Now a very, very gentle way of doing that would be to use derma roller. Derma roller is what's known as medical microneedling. Now medical microneedling is a very safe and effective way of regenerating skin and reducing acne scarring as well. What you would do is you would simply place a topical anaesthetic on the face for about 20 to 30 minutes and then pass a roller with 1.5mm needles across the surface of the cheek over here and across the forehead here where there's this marbling effect from the past. Now what that would do is it would effectively help to regenerate the skin. New collagen fibres would come into the area, repair the scar tissue and give you an overall better glow. It has very similar effects to laser treatments but with a lot less downtime than you would get with lasers, but also you would get very, very similar results. Okay, I'll talk you through the procedure of derma roller. What we use is a topical anaesthetic of 4% lignocaine cream. We'd apply it to the face, leave it on for approximately 20 to 30 minutes. We would then take one of the genuine derma rollers, a 1.5mm to the face, and it has microscopic needles on a roller. You would then take the roller out of the packaging. I'm going to leave this in because it's sterile, and then it would be passed over the area of the cheek in a cross-hatching method in several directions for approximately 6 to 10 passes over the area. The greater the scarring, then the greater the amount of passes that you would use. You would look for an end point which would give someone a sun-blushed look and maybe with a bit of pinpoint bleeding. The procedure should be slightly uncomfortable but should never be painful, and in most people would say that it feels like ants walking across the skin and no more than that. Okay. It would also be very, very good for Alex if we decided to avoid using Botox. These fine lines and wrinkles that have already started to develop, they should significantly decrease by the use of derma roller, because in these creases, these static lines across this area, what we would hope to do is get new skin formation and therefore decreasing the lines, and we would get new elastin and new collagen coming into the areas, and these would reduce that. And that would probably only take with someone so young about one treatment, because as the scars get deeper, as the age increases, then what we would start to think about is using maybe 2 or 3. And if someone had very, very pronounced acne scarring or ice pick scarring, then we would definitely need between 3 and 4 treatments of derma roller.